everyone, I am Dr. Purnashri and I will be discussing question papers on Orthodontics. So the topics that we will be discussing today will be general principles and concepts, introduction to Orthodontics, and development to dentition and occlusion. The first topic, general principles and concepts. So we'll start discussing the long essays followed by short essays and the short notes. The first question is enumerate various theories of growth. Explain the mode of action of Frankel appliance with reference to functional matrix hypothesis. So your answer will consist of firstly definition of growth, then followed by enumerate various theories of growth. So you enumerate them. Then the mode of action of Frankel appliance with reference to functional matrix hypothesis. So first you define growth. Then we list out the theories of growth. Genetic theory by Brody, Sutural theory by Seicher, cartilaginous theory by James Scott, functional matrix theory by Melvin Moss, Van Limburg theory by Van Limburg. Then there are other theories related to craniofacial growth. These are the Enlow's expanding V principle, Enlow's counterpart principle, neurotrophic theory, and the servo system theory by Petrovic. This is a very important list of theories because this is frequently been asked, that is enumerate various theories of growth. Coming to the next part of the question, that is to explain the mode of action of Frankel appliance with reference to functional matrix hypothesis. So first you can just start by shortly mentioning what is the functional matrix hypothesis, and you can draw this flowchart that will sum up the entire hypothesis. That is, functional cranial component consists of two parts, the skeletal units and the functional matrices. So under skeletal units, there is macroskeletal units. So macroskeletal units are the skeletal tissues associated with a single function and are called the skeletal unit. And then the microskeletal units are the smaller parts of the whole unit. So example, if the macroskeletal unit is the mandible, then the microskeletal units will be the parts of it, the coronoid, angular, mental, gonial, alveolar process, etc. The functional matrices are again divided into periosteal matrices and the capsular matrices. So the periosteal matrices will act directly on the skeletal units. Example, the teeth and the muscles. The capsular matrices act indirectly and passively on the skeletal units so as to produce a secondary translation. So the example will be the neural mass, that's the brain and the tongue and the respiratory spaces, oral cavity space, etc. Then you can explain the mode of action of a Frankel appliance. So the Frankel appliance has two acrylic components, the buccal shields and the lip pads. These eliminate any abnormal forces acting on the teeth and the bones. So it causes an outward pull on the connective tissue and the muscle. So what are these connective tissue and muscles? These are the periosteal matrix according to the functional matrix hypothesis. So by causing outward pull, this acts on the underlying bone and causes the bone formation. The next mode of action is muscle adaptation. So the Frankel appliance, it helps in massaging the soft tissues, loosening the tight muscles, improves the blood circulation, improves the muscle tonicity, and provides a new functional matrix for perioral muscle to act upon it. So we call this the ought to be matrix. Ought to be matrix means where the muscles should be lying in an ideal position. Okay. Then there is mandibular forward positioning. The Frankel appliance positions the mandible by gradually training the protractor and the retractor muscles, followed by the condylar adaptation. That ends our first question. Now coming to our second question, what are the methods of bone formation, and explain the process of remodeling of bone. So these are two parts. The first part is what are the methods of bone formation. So the process of bone formation is called osteogenesis. There are two methods. First is endochondral bone formation, second is intramembranous ossification. So as the name suggests, endochondral, that means first a cartilaginous model is made and that is replaced by bone later on. Whereas in intramembranous ossification, the bone is laid directly in a fibrous membrane. Coming to second part of the question, that is process of remodeling. So bone changes in shape and size by two mechanisms, that is deposition and resorption. So this bone deposition and resorption together are called as the bone remodeling. So you can explain this under 5 phases. There is activation, resorption, reversal, formation and quiescence or resting phase. You can add this diagram also by specifying these 5 phases. Then the third question, define growth and development. Describe in detail postnatal growth of mandible. So sometimes you can also be asked the prenatal growth of mandible. You should be prepared for both. And this definition of growth and development has been asked multiple times. There is no specific one definition for growth and development. There are multiple definitions. You can find them anywhere. These are the authors and the definitions that they have given for growth. These are the definitions for development and the authors who have given it. You can at least learn two definitions for growth and 2 definitions for development. Then we can explain the second part of question, that is postnatal growth of the mandible. So whenever you are asked about postnatal growth or prenatal growth of maxilla or mandible, the most important thing while you're studying and writing answer is diagrams. That is must. So these are the diagrams that you can draw. So when you are learning also, if you learn these diagrams, you can easily remember what are the changes that are happening. So the plus signs indicate the deposition, the minus sign indicate the resorption. So when you are explaining, you can explain it under the following headings. The ramus, so the changes that are occurring in ramus. So you can easily look at the diagram and say there is deposition of bone on the posterior surface of the ramus and there is resorption on the anterior border of the ramus. Similarly, for the body of the mandible, angle of the mandible, lingual tuberosity, alveolar process, the chin, the condyle, coronoid and the coronoid process. So the next question is define growth. This I have already explained in the previous answer. Enumerate various theories of growth. Like I've said, this has been asked multiple times, that the list you already know. And then the third part is explain the functional matrix theory in detail. So functional matrix theory was given by Melvin Morse. It states that the bone growth within the craniofacial skeleton is influenced primarily by function. Okay, so this flowchart I've already explained previously. You can explain these macroskeletal units, microskeletal, periosteal matrices, capsular matrices in detail, and then you can also explain in relation to an example. For example, the mandible. The macroskeletal unit will be the mandible and the microskeletal units will be the condylar process, coronoid process, alveolar process, the chin and the angular process. The functional matrices, the capsular matrix for the mandible will be the oral capsule that acts on the macroskeletal unit and brings about passive growth or translation. And the periosteal matrices act on the microskeletal units. The periosteal matrices example will be the teeth, the muscles, nerves that are present, and these bring about active growth or transformation. That ends our answer. Coming to the short essays in this topic. The first question is enumerate various theories of growth and explain sutural theory. So enumeration we have already discussed. Coming to sutural theory, it was given by Weinmann and Seicher in 1952. So this theory, it suggests that all bone growing elements, that is cartilage, suture or periosteum, are growth centers. So Seicher believed that the craniofacial growth occurs at sutures. That is why it's called the sutural theory. So you can also add about the points that are against this theory. So they found that there is no growth occurring in area where suture is transplanted. And another point is growth at suture responds to outside influences such as compression and tension. The next question is explain functional matrix hypothesis. This we've already discussed. So the next question is what are growth spurts and mention its clinical significance. Growth spurts, first define it. This refers to sudden increase in growth of general body. Okay, then you explain the clinical significance. So growth spurts help in determining the predictability, the growth direction, patient management and total treatment time that is required. It also helps in understanding the growth, the future growth of maxilla, mandible, the alveolar process. So it helps in diagnosing and achieving good results. Then it also main thing is helps in functional jaw orthodontic therapy. That is the activator bionator if you're giving any functional appliance and takes advantage of the redirecting the remaining growth that is present. Another thing that you can add in this answer is the ages of the growth spurts. There are three types of growth spurts, the infantile and one during the mixed dentition or the juvenile growth spurt and the prepubertal or the adolescent growth spurt. So the timing of this growth spurt in males and females is different. So you can add this as well in this answer. The next question is enumerate various methods of studying bone growth, explain cortical drift and displacement with respect to craniofacial growth, giving suitable examples. So the first part is enumerate methods of studying growth. There are two methods basically, experimental approach and the measurement approach. Then the next part is explain cortical drift and displacement with respect to craniofacial growth and examples. So cortical drift means a combination of bone deposition and resorption resulting in growth movement towards the deposition surface is called as the cortical drift. What is displacement? It is movement of the whole bone as a unit. So again displacement is of two types, primary displacement and secondary displacement. So primary displacement means the bone is moving as a result of its own growth. So for example, growth of maxilla tuberosity region occurs due to the growth of the maxilla in that region. Okay. Secondary displacement means the bone is getting displaced as a result of growth or enlargement of the adjacent tissue or the bone. Example, the growth of cranial base will cause the forward movement of the maxilla. So the maxilla is moving because of growth of the cranial base. So this is called as the secondary displacement. Coming to the next question, that is enumerate theories of craniofacial growth and add a note on Scott's cartilaginous theory. Enumeration, you know the list that has to be put, and then we'll discuss the cartilaginous theory. It was given by James Scott in early 1950s. So he said the cartilaginous sites are present throughout the skull and these are the primary centers of growth. So he concluded that the craniofacial regions are dependent primarily on cartilage and secondarily on the sutures. So he said cartilage is the main center of growth and sutures are only secondary to it. So you have to add the points that support the theory and then you can explain an example. So he explains that the mandibular condylar cartilage are the growth centers for growth of mandible and the growth of this cartilage pushes the mandible downwards and forwards. So the next question is what are the different theories of growth? So you can see how many times that theories of growth, enumerate theories of growth has been asked and describe in detail Melvin-Morse theory. So when they ask, they can ask you by the author's name also. What is Scott's theory or Seicher theory or Melvin-Morse theory? Like that. So you should remember the author's name also. So when they say Melvin-Morse's theory, they are talking about the functional matrix theory that we have already discussed in the previous answers. Now coming to the short notes. Spheno-occipital synchondrosis. So spheno-occipital synchondrosis is a cartilaginous junction between sphenoid and the occipital bone. So this is a major contributor in the postnatal growth of the skull. This fuses by 12 to 13 years in girls, 14 to 15 years in boys, and then it ossifies by the age of 20. So how does it help us? It carries anterior part of the cranium forwards. So if it ossifies early, that there is premature ossification, this forward movement will be obstructed. So it will cause depressed nasal bridge and descent face. The next question is incompetent lips. So incompetent lips are anatomically short lips with a wide gap between the upper and lower lip in relaxed state. So the patient will not be able to close the lips even if they try to, because it is short. Whereas potentially incompetent lips are labially placed upper incisors. If the teeth are placed too forward, they interpose between the lips and prevent the normal lip. So that because of the teeth, the patient is unable to close the lips fully. So those are called as potentially incompetent lips. Next question is Tweed's triangle. So Tweed's triangle is a cephalometric evaluation. It was given by Dr. Charles Tweed to establish a diagnostic facial triangle. Primarily, it measures the Frankfurt mandibular angle and the position of the lower incisors. So he uses three planes, that is Frankfurt horizontal plane, long axis of the lower incisor, and the mandibular plane. So this is the diagram. You can see this is the Frankfurt horizontal plane, mandibular plane, and the long axis of the lower incisor. And he calculates three angles. FMIA, that means Frankfurt mandibular incisor angle. FMA, that is Frankfurt mandibular angle. IMPA, that is incisor mandibular plane angle. So these three planes form the triangle called as the Tweed's triangle. Next question is synchondrosis. Synchondrosis are bands of cartilage that remain at the junction of various bones. So these bands are considered as a growth center and pacemaker for cranial base. So then you can, there are four synchondroses that are present in the basic cranium. You can list them out. Next is growth center. Growth centers are special growth sites which control the overall growth of the bone. Example are the epiphyseal plates of the long bone. So these growth centers have an inherent genetic potential. That means they have their own growth potential and they're independent of environment. So it doesn't matter if you're putting tension or compression on the growth site, they will continue to grow. Extirpation, and that means if it is removed, if the growth center is removed, the bone will stop growing. And resemblance to the epiphyseal. The other short notes that were asked are functional matrix, primary displacement, and displacement. This we have already discussed previously. Now let's move on to the next topic, that is introduction to orthodontics. Here short notes have been asked in the previous question papers. What are the branches of orthodontics? So these are four: preventive orthodontics, interceptive orthodontics, corrective orthodontics, and the surgical orthodontics. Jackson's triad. So Jackson's triad gives the aims and objectives of orthodontics. Okay, it was given by Jackson. It consists of three parts: functional efficiency, structural balance, and aesthetic harmony. You can just draw this triangle and name these parts. Coming to the next topic, that is development of dentition and occlusion. The short essay that was asked are: what are the stages of development of occlusion? Explain the changes taking place in development of occlusion between 6 and 12 years of age. So the first part is stages of development of occlusion. These are pre-dental period, that is before the teeth erupt, deciduous dentition period, mixed dentition period, and the permanent dentition period. Now the second part of the question, they ask the changes between 6 and 12 years of age. So 6 years is the age when the first permanent tooth erupts. That means they're talking about the mixed dentition period. Okay, so what are the changes that are taking place? So you have to explain about the changes in the mixed dentition period. These you can divide into first transitional period, inter-transitional period, and the second transitional period. And you can draw diagrams as well wherever necessary. The next question is, what are transient malocclusions? Add a note on ugly duckling stage. So first define what are transient malocclusions. These are self-correcting malocclusions encountered during the development of dental occlusion, which are normal for that age. Okay, so then you can add the some of the transient malocclusions that occur. Then add a note on ugly duckling stage. So ugly duckling stage, it occurs during the eruption of canine between 8 to 9 years. So there is, as the canine is developing, it applies pressure on the lateral incisor, causes distal movement of the central incisor, and there is a spacing. So this is called as ugly duckling stage by Broadbent. He gave this phenomenon first, so it is also called as the Broadbent phenomenon. And it is called ugly duckling stage because children tend to look ugly during this period. So you can draw the diagram as well with this answer. Coming to the short notes on this topic, what are balancing extractions? So balancing extractions may be defined as removal of tooth on the opposite side in the same arch in order to preserve symmetry. So what this means is, if you are extracting a tooth in the first quadrant, you will be removing another tooth in the second quadrant as well, so that the midlines and the symmetry are matching. The next question is couple and its role in orthodontic tooth movement. So first you can define the couple and then you can tell about its role. So couple means when there are two forces equal in magnitude and opposite in direction. Whatever is the net force that is acting is called as the couple. So there is no translation because the forces are equal in magnitude and they are opposing each other, so they cancel out, so there is no movement of tooth. But what happens is pure rotation around the center of resistance. So the clinical role of couple is, we can apply couple only to the exposed part of the tooth. Depending on which plane the couple is acting, they can cause rotation, that is first order, tipping second order, torque third order. Then early and late mesial shift. So this again comes under the mixed dentition period. Early mesial shift means when the first permanent molar is erupting, it pushes the deciduous first and second molars forward to close the primate spaces, that is the generalized spacing that is present, to establish a class 1 molar relationship. That is early mesial shift. Whereas in late mesial shift, if the primate spaces are absent, then as the first permanent molar is erupting, it utilizes the leeway space. Leeway space is the difference between the deciduous molars, the size of the deciduous molars, and the permanent premolars that are going to erupt in that place. So this difference is called the leeway space. So in maxilla it is 0.9 mm per segment, that is 1.8 mm in the maxilla, and mandible it is 1.7 mm per segment. Both the quadrants together it is 3.4 mm. So with that we come to an end of today's question paper discussion. So if you have any questions, doubts or suggestion, you can leave it in the comment section.